Good afternoon. It's a tremendous honor to be here to welcome you to this panel of very distinguished speakers on the subject of COVID-19 and the rights of persons with disabilities. I'll begin by introducing them very briefly. Then I'll say a few words of welcome and mention a few preliminaries before we move into our speakers' presentations and our discussion period. Our speakers, it's such a privilege to introduce each of you, are Dr. Ben Gauntlett, Disability Discrimination Commissioner of the Australian Human Rights Commission, Catalina Devandas, Special Rapporteur on the Rights of Persons with Disabilities, the United Nations Human Rights Office of the High Commissioner, Mohamed Farah, founder, Somali Disability Empowerment Network, and Amanda McRae, Director of United Nations Advocacy Women Enabled International. This is a crucial and vital time for this discussion of COVID-19 and the rights of persons with disabilities. As the UN Secretary General wrote this week, the COVID-19 crisis is affecting every aspect of our societies, revealing the extent of exclusion that the most marginalized members of society experience. And his most recent post highlighted, especially affecting the world's 1 billion people with disabilities. Continuing what he said, the share of COVID-19 related deaths in care homes where older people with disabilities are overrepresented ranges from 19% to an astonishing 72%. In some countries, healthcare rationing decisions are based on discriminatory criteria such as age or assumptions about quality or value of life based on disability. We cannot let this continue. We need to be having this conversation. We need to be having many such conversations, of which this is one. Thank you to each of you for being here to begin to talk about the diverse range of issues that need to be addressed concerning this pandemic and people with disabilities. When I was getting ready for this session today, I was noticing that I was feeling a little nervous about the technology, about the mishaps that can occur. And I was reminded of an event that took place in my disability law class a few years ago. Haben Girma, a deafblind lawyer and writer known to many of you, I'm sure, was coming to speak with my class for a short while by Zoom. This was well before everything was by Zoom. And she emailed us just before to say that her interpreter was running late and wouldn't be there, after all, in time for the session. And for a moment, it looked like we might need to cancel, reschedule. It looked like this event was not going to happen now because of the intersection of technology and access. And then the class put their heads together and figured out that we could still do this video conference if we innovated. And so we found a way to, and with her in dialogue, figured out that we could send questions to her by email. The group could come together and decide on them. She could receive them and reply aloud through the video. And in the time lag, the class could be discussing what questions to pose collectively. And so what looked like an obstacle, a mishap, perhaps something that wouldn't happen at all, turned into a particular learning opportunity and a moment of collaboration and innovation. And turned into one of the more meaningful events, in a sense, that happened that semester for that particular group of students. Showed everyone in the class how much disability and technology and moments that look like obstacles could lead to innovation and to opportunities. This isn't news to anyone here, I'm imagining. But for me, when I first started working on disability issues as a person among the not yet disabled, this was one of the things that really struck me, that an area that people tend to think of for its problems, its needs, disability, so often becomes a place of opportunity and possibility when people really collaborate and put their heads together. This is something to reflect on as we go into a session on that is Zoom-based, that may have its own issues. We were just talking before we started, what happens if my internet goes out? We now have a plan for who will step in. I also want to mention, there is for you, all participants, the possibility of submitting questions. We hope you will submit either to the Q&A function in Zoom or by tweeting with the hashtag COVID-19 Justice, hashtag COVID-19 JUSTICE. And you also, if there are things that we can do to make this more accessible, please tell us also through those media what we can do to make this more accessible. In this moment when we're facing such tremendous suffering and seemingly insurmountable obstacles, including grappling with our own particular circumstances, challenges, or the privileges, or both, we're also gathering in ways we didn't imagine before, including this gathering. And I trust this will be a conversation about the incredible challenges before us, and also the opportunities and the possibilities. And with that, we'll turn first to Dr. Ben Gauntlett. Ben.
Distinguished guests, ladies and gentlemen, fellow speakers, thank you to Professor Emens for that kind introduction. COVID-19 exacerbates disadvantage, but in doing so, it highlights the importance of the Convention on the Rights of Persons with Disabilities and human rights more generally. Post-COVID-19, there will be a need for it to be equally vigilant to protect the rights of people with disability. This is done by including people with disability in the policy decision-making framework. It is a pleasure to be asked to address you on COVID-19 and the rights of persons with disabilities. Although the global pandemic has led to a number of unfortunate consequences for people with disability, a pleasant consequence has been the use of technology to enable communication from remote areas. In this respect, to be presenting to you from Australia in New York is, in a sense, a luxury, an honour, a privilege, and truly remote. Today, in my remarks, I wish to emphasise 3 points. First, when we discuss awareness raising and its importance, we need to be especially mindful of the training we give government officials, health professionals, educators, media and first responders or emergency service personnel. This awareness is one of rights, not just of the existence of people with disability. Rights to make supported decisions, rights to accessible communication, rights to equitable access to healthcare and non-discrimination. Second, the inclusion of people with disability in decision-making at the highest level of government aids effective decision-making. And third, when we discuss the right to health, it cannot be divorced from the need to acknowledge the concept of reasonable accommodation, that there is a difference between formal equality and substantive equality. Medical ethicists can, on occasion, not be aware of the principles underlying the CRPD, and frailty scales, etc., can be discriminatory. Issues concerning intersectionality need to be considered when discussing equality, particularly when essential services are concerned. Education on these issues needs to be ongoing. To say that the global pandemic exacerbates discrimination and challenges faced by persons with disabilities is, in a sense, obvious. But at the same time as exacerbating discrimination, it highlights why reference to the social model of disability is so important. When laws, regulations, and policies are changed rapidly to suit global circumstances, there is an overwhelming need to sometimes reflect upon what is occurring. Human rights exist to ensure that the dignity of all is protected. Today, I present to you an Australian perspective of the response of a first world country to COVID-19. It is important to note that compared to other countries, Australia has had very few instances of COVID-19. That is in part, I suspect, a consequence of geography, but also a reflection of a relatively sophisticated healthcare regime. At last count, there were 6,890 cases of COVID-19 in Australia, of which 6,035 had recovered. Only 759 were active, and there were 96 deaths. Even on a per capita basis, that has thankfully been very few instances of COVID-19. But while there have been very few instances of COVID-19, a policy response of federal and state government has been to impose quarantining, self-isolation and social distancing measures. This has meant that people with disabilities who are deemed vulnerable have been living in various levels of isolation for extended periods of time. Their services have been compromised. fear and anxiety has occurred, with the increased risk of violence and abuse. And in response to international events, questions have been asked about what should occur if a person with a disability enters into a hospital system, and more particularly intensive care. These health policies have had a significant impact upon employment, education, housing, and the provision of services in congregate settings or particularly group homes. Where services have had to adjust for people who have and who have not had a disability, such as in education, the need for accessible services has sometimes been overlooked. This has also applied for the provision of personal protective equipment. Isolation has been imposed on people rather than discussed as a need. Support for decision-making has not always been present. But the word vulnerable has been used rather than disability until very recently. Policies for aged care were explicitly announced, but disability was left silent. A press release was made rather than the issue of disability being referred to in a national press conference. Politicians have not explicitly engaged with the issue of disability and COVID-19 in public settings, but neither has the media. The lack of reference to disability is a global issue. Until recently, when disability issues have been raised, it has been in a piecemeal manner. In part, this is reflective of low levels of hospital admissions of people with disability with COVID-19. But following significant advocacy from civil society, changes are occurring. In recognition of the significant impact of the pandemic on people with disability, the Australian Government has established an advisory committee which reports to the Chief Medical Officer, Professor Brendan Murphy, and has people with disability on it. In my statutory role, I sit on the advisory committee, which meets regularly. Perhaps unsurprisingly, one of the earliest roles of the advisory committee is to devise a communications strategy. The Australian Human Rights Committee has been tasked with drafting a health and human rights framework for people with disability to be used across Australia. Several resources are also being produced that will seek to ensure people with complex support needs, people with psychosocial or intellectual disabilities, and people with communication disabilities are properly assisted in the health system. In a sense, flattening the curve has enabled this to occur. It has also meant that a mature discussion of what is reasonable accommodation in the healthcare could and will take place. This issue is not resolved, but the wheel is turning. Good healthcare practice accommodates all people and acknowledges the potential for bias, not just on the basis of disability, but that can especially be the case when intersectionality is considered. Clinicians are starting to be aware of this issue and that previous notions of frailty are outdated. In conclusion, as the health issues caused by COVID-19 dissipate, the economic and social participation concerns for people with disability will arise. In Australia, as in the rest of the world, a disability-inclusive COVID-19 response and strategy is good policy. It ensures no one is left behind now and in the future, but it is made with and not for people with disability. Thank you.
Thank you very much, Ben. I wanted to mention before we move to our next speaker, to make sure that people know that you can click on closed caption at the bottom of the screen, then show subtitle in order to get the captioning. And now I'm delighted to introduce Catalina Devandas. Please.
Thank you very much for the opportunity, and thank you to the Columbia Law School and the Human Rights Institute for inviting us to discuss these issues. I believe that one of the most important reflections that I would like to have this afternoon, this morning, whatever we are with you, is what has been the impact on of the Convention on the Rights of Persons with Disabilities and the current pandemic, and if we had created the strong foundations to actually allow for a human rights response to persons with disabilities during this pandemic. And unfortunately, my assessment so far is that no, that's not the case, that we are learning very sad lessons during this pandemic, that despite advances in the recognition of rights of persons with disabilities over the last 10, 12 years around the world, we're still far away from actually including persons with disabilities in a meaningful way in all our actions, right? What we have learned is that persons with disabilities continue to be an afterthought in the design of the responses strategies, but hopefully, and this is partly why we need to discuss these issues, hopefully it won't be an afterthought in the recovery efforts that are starting very soon. So what we have seen, of course, is that persons with disabilities, and you mentioned that, Elizabeth, at the beginning, as quoting the Secretary General brief, have been one of the hardest hit groups in this pandemic, right? In terms of fatalities, which is a very, very sad development because of the isolation and the structural challenges that the disability community has been denouncing for decades and decades about the situation of institutions and the institutionalization. And that is just resulting in these places becoming hotspots of the infection, and of course, places where the big majority of the fatalities, at least in Europe, are occurring. But then, of course, we are at greater risk of acquiring the infection because of multiple factors. One of them is, of course, poverty and structural challenges that make persons with disabilities more susceptible of acquiring the virus, not having access to water and sanitation, poverty that undermines our immune systems, comorbidities, but also structural barriers that limit our access to services, health services, accessible services, the disruption of the support services. And I think that this is a fundamental challenge that we have faced because still support services for persons with disabilities are considered as informal and are not fully recognized. So when we took all these security measures or emergency measures, the whole support services for persons with disabilities were interrupted and without any measure in place to think about how to replace them or to have alternative solutions for persons with disabilities. The whole discussion that is very prevalent in the US and in many countries also in Europe was the discussion on the triage. What do we do when we have limited resources and when we need to grant access to only a limited amount of people to emergency units or ventilators, and the triage protocols that were arising everywhere that were as a default discriminatory against persons with disabilities, in some cases even sending rehabilitation, non-resuscitation forms to potential persons with disabilities that potentially could acquire the virus. So all of these reactions locally, I think, because we had the convention, some of this was immediately picked up by the organizations of persons with disabilities, by human rights defenders, by media, and some of it were reviewed. Still, some of them are being contested, challenged in the US. Even some cases are being brought to court. So, but all of this is to say, no, we were not ready to provide a human rights-based response to persons with disabilities during a pandemic, right? And so how? And I think this is the question now. How are we going to make sure that this won't continue to be as a patch to a strategy to solve the thing or to think about future pandemics? How are we going to truly integrate a human rights-based approach to protect the rights of persons with disabilities on an equal basis with others in these situations? We understand that in situations of emergencies, we are all affected and our rights will be limited somehow. But there cannot be abuses in how these limitations or these measures impact in a disproportionate way to persons with disabilities. So we are seeing, and I would like to discuss that further, as well as in many countries, sometimes there is an excuse to use the security measures to limit human rights enjoyment in a way that is not proportional. Also, in the case of persons with disabilities, there are specific ways in which, in the case of persons with psychosocial disabilities, to give you an example, we institute or we add regulations that restrict the rights of persons with disabilities without any proportionality. Meaning now we are allowed to force treat persons in psychiatric facilities because it's sometimes easier for management to do that, right? So how do we avoid limiting the rights of persons with disabilities in that kind of situation? And how do we deal, and with that, I'd like to go to the second part of my presentation, and I will be very brief. What would be the key elements that we need to consider in the recovery stage to make sure that we are building disability inclusive recovery responses? We have to insist on the need of having, of course, a non-discriminatory framework to be very clear about how we make sure that nothing is going to result in discrimination or the creation of barriers for persons with disabilities. How do we look at a participatory mechanism? Do we need to engage and consult meaningfully with persons with disabilities and the representative organizations? How do we move away from only segregated responses, and we think more and more in this twin track approach in which we need to mainstream the rights of persons with disabilities in any policy response that is global, and we still need to think that in some cases we might need specific responses for persons with disabilities. So how do we balance both? What type of accountability mechanisms are we going to have in place to make sure that persons with disabilities can also, that the government agencies, donors can be held accountable, and that persons with disabilities have access to remedy and to claim for the rights. So those elements are fundamental to make sure that once we are planning, and in some cases it's already happening, the recovery for the health sector, making sure that universal healthcare is accessible for persons with disabilities, that we protect persons with disabilities and institutions, but most of all, that we continue and finalize with the process of deinstitutionalization. This is not longer a discussion that should be taking place. We need once and for all, to close the institutions, and this includes an important discussion with the older people's rights groups and a problematization of how we're going to look at the nursing homes in the future and what is the policy advice that we can give from a human rights-based perspective. How are we going to design and rethink about the support services that are needed to support independent living in the community, and to make sure that in case of an emergency, the disruption of these services is not going to disproportionately affect the lives of persons with disabilities, because some of our population might also be dying because the support that they need to survive is not there anymore. And then the issue of social protection. I think social protection, it's fundamental to ensure that persons with disabilities will be considered during the crisis, and the issue of education as well, how it has impacted on children with disabilities in particularly, and how do we need to build back better in the recovery process. I know it's a lot, so I will stop here. I think that I would like to have this reflection with the panelists and with the participants. But again, I would like to say that we haven't really been truthful to the commitments to the CRPD, to the Convention on the Rights of Persons with Disabilities, and that we still have to think in better ways in which we need to approach the rights of persons with disabilities in the pandemic and after the pandemic. Thank you very much.
Thank you so much. And now to Mohamed Farah. Mohamed?
Thank you all who are behind this fruitful meeting, especially Columbia Lab of School and other organizers for this fruitful virtual meeting. As every person knows, and already my colleagues have talked before, persons with disability among other persons with disability, among other vulnerable and marginalized groups, experiencing the highest degree of socioeconomic marginalization. They become even more vulnerable into the emergency. This is due to factors such as lack of access to the effective and earlier warning system into the health service. The COVID-19 outbreak is predicted to have significant impact to various sectors. The population must be risked at those significantly maybe the people who depend on heavily informal economic, also those occupy areas prone to be shocks, and those who have inadequate access to social service and political influence, also those who have a limited capacity and opportunities to cope and adopt, and the last, those who are limited to that no access to technology. So that in this case of this pandemic disease, for example, in Somalia, the country that we are working and living, there is no specific issue and consideration for people with disability. And I know many African countries same like that. People with disability are estimated 1.5 billion people, and 8% of those population are living the global south or developing countries. Most of them, they are poor, are the poorest, and this pandemic disease will become a huge impact for them. For example, socioeconomic, and also it may take a risk of their life. Some of them they are dying without accessing healthy providers, proper healthy providers. For example, in my country, we have already registered more than 6 people died, especially those who are vulnerable people, those who are disabled people, who are or beneficiaries also, certain beneficiaries. They have died without testing that they are COVID-19 because of lack of proper health care system. They don't have access to the health providers, and the government does not give them a special consideration and even mainstream consideration, because of we have discussed some officials from the government that to make this pandemic disease mainstream or inclusive consideration for all people. For example, people with disability cannot practice social distance. Most of them, when we are talking the reality, they need assistance. Those who are in a care home cares, they need assistance. So they have to get special awareness for them, how they avoid the risk and also to mitigation the risk of the COVID-19. So the problem we have so far, people are not aware even. Most of them, they are not aware. They don't know what's going on. They don't know. They are dying, they are suffering COVID-19, but they are not getting any test even. So I think what we need to overcome all these challenges is to make, to disseminate information to the public, radios and TVs, to make huge awareness through these people. Also, we need to make a center, the disabled people's issue, to make a center for the prevention methods from the states and non-state actors. For example, people with disability are segregated and stigmatized among other people. So what we need to know, just we need to involve all the process that's going on due to this coronavirus disease, to make a center for every aspect of their life as other people. So in my conclusion, I will suggest all governments, all state actors who have signed the UNCRPD and others, to make sure that people with disability have a right of proper health care, have a right of proper shelter, So we need to argue them or to plead them to make more consideration for people with disability, especially UN and other non-state actors. Thank you.
Thank you very much. Finally, Amanda McRae. Amanda?
Thank you so much, and thank you for including Women Enabled International as part of this panel. Women Enabled International works to advance rights at the intersection of gender and disability to amplify the voices, in particular, of women and girls with disabilities worldwide. What we've observed in terms of our capacity working on issues affecting women and girls with disabilities primarily is that the initial response to COVID-19, while it has in some ways, though not adequately, addressed the needs of women and included some voices of persons with disabilities, it has rarely, if ever, thought to include the intersection of gender and disability in the conversation. And this is despite the fact that women with disabilities are more than half of all persons with disabilities worldwide, so that 1 to 1.5 billion people, more than half of them are women. And furthermore, that women with disabilities account for nearly 20% of all women as well worldwide. So we're talking about a significant portion of the population. In addition to that, non-binary, trans, and gender non-conforming persons with disabilities have been almost totally left out of conversations about COVID-19 response, but also about conversations concerning rights for persons with disabilities. In response to this, Women Enabled sent out a survey in mid-March to target women, girls, non-binary, trans, and gender non-conforming persons with disabilities to get a sense of their lived experience during the COVID-19 crisis and due to the government and healthcare responses to that crisis, so that we could advise the governments and other stakeholders about how to address those needs in the short term, and then how to fix the problems that have led to those needs in the long term. That survey has got 100 responses to it from women, non-binary and trans persons from every region of the world, and with a variety of types of disabilities as well. And they have identified 3 major issues that are impacting them in ways that appear to be different from other people in the community who are being impacted by COVID-19. The first of those issues is that this is having a profound effect on both the physical and mental health of primarily women with disabilities, which is the shorthand I'll use to talk about this group. And particularly concerning their physical health, women with disabilities identified that some of their disability-related health needs, including pain management, physical therapies, mental and other appointments and procedures related to their physical health have been canceled entirely, or that their appointments are being moved to telehealth. And in particular, concerning sexual and reproductive health and rights, there was a woman who I responded to the survey who was 9 weeks pregnant, had chronic illnesses, and was experiencing intense nausea and vomiting and lethargy, and was not getting any attention from her health providers, who were overstretched due to the crisis, and who were also only seeing her via 1 phone call so far in that 9 weeks of pregnancy. These types of concerns were almost universal in the survey respondents that we heard from as part of this crisis. But in addition to physical health, the mental health of women with disabilities has also been particularly impacted. Women with psychosocial disabilities identified that because there has been such an increase in demand for mental health services, that they can no longer access their service providers when they need them, which is exacerbating mental health conditions. But beyond that, the stress of COVID-19, the isolation that comes as a result of disability, amongst other factors and government responses, has also exacerbated mental health related conditions or created them in many women with disabilities. One factor that in particular has contributed to that is that many of the people we surveyed were very fearful of the discussions of rationing of healthcare that have been going on, which others have alluded to as well. In particular, most of the respondents to our survey identified that they felt their health systems were not ready to deal with a crisis like this, and that they anticipated that at some point healthcare providers were going to be having to make decisions about to whom to provide life-saving or even other types of medical care. Because of the historical discrimination and ongoing discrimination against both women and persons with disabilities, most of the respondents felt that they would be in the back of the line to receive such care. And that in themselves was making them very fearful of trying to access hospitals, but just for their lives generally to try to access their community, should they get COVID-19 or fall ill in another way. In addition to physical and mental health related needs, women with disabilities also identified that they were having increasing trouble meeting their basic needs on a daily basis. This was for several reasons. One is that of the women with disabilities who were employed, a significant number of them had either lost their employment, had to cut back on their employment because they didn't have needed technologies to work from home, or didn't have employment to begin with, which meant that and their income supports were falling through. And because of this, income related to buying food or paying personal assistance, et cetera, had evaporated for them. Beyond that, formal support services, things like personal assistance or support from the community, had either been suspended or were no longer accessible, or people were afraid to leave their homes to go and access them. Public transportation, which is an essential service for many persons with disabilities more broadly, but women and girls with disabilities specifically, in some contexts has been shut down or has increased dramatically in price, which means that people are not able to navigate their communities in the same way they used to. And then the informal network of supports that Catalina referred to that many persons with disabilities rely on, like family, friends, or even just members of the community, because of social distancing rules and limits on movement, are no longer available to them. So for instance, we had a couple of women with visual impairments who responded to the survey, who noted that they live independently just fine on their own, but the one thing they need is someone to help them cross the street to get to the grocery store or to get to a service, and people were no longer willing to do that because of social distancing related rules, because of fear of this virus, and that put their ability to meet their own needs in jeopardy. When this happens, when one's ability to meet their own needs, even with support even, is put in jeopardy, it means that they're going to have to rely potentially on others who might exploit them, who might subject them to violence or abuse. And this puts particularly women and girls with disabilities in a vulnerable position. But it also means that these people might be institutionalized in violation of various rights, including the right to live in the community and elsewhere, and in institutions be even at higher risk of acquiring COVID-19, but also at higher risk of violence and abuse, as Catalina also referred to. And then finally, the other issue that was highlighted specifically in our survey was that many of the respondents felt an increase in their risk to their personal safety as a part of COVID-19. You've likely seen discussions about the epidemic of domestic violence that has been occurring as a result of COVID-19. Women and girls with disabilities are already at least 2 to 3 times more likely to experience violence than other women. The epidemic of domestic violence, it's unclear how it's impacting women with disabilities, but we did have respondents who indicated to us that they were either afraid of the family with whom they were forced to be living and the abuse that may result from that, or from their domestic partners with whom they were living and who they were afraid of abuse from, particularly as those family members and partners would need to increasingly provide those individuals with their basic needs and support services that they had previously relied on others to provide. Beyond that, there were a few people who also identified specific disability-related risk factors to their personal safety, including a woman in Southern Africa with albinism who reported that her community felt she was more likely to carry COVID-19 because of her lack of melanin in her skin, and another woman in Colombia who reported that when she had gone to the bank to try to withdraw money, people verbally abused her and backed away from her and were afraid of her because of her disability. They thought she may also be a carrier of COVID-19. And beyond that, as I identified before, risk factors for violence are also increasing, including increasing dependence on family and partners for income and also for meeting basic needs, as well as kind of increased stress on caregivers, including family and partners but also formal support services that still exist because of lack of things like personal protective equipment or cuts in services and pay, which means that they're receiving lower pay than they did before. So Women Enabled will be releasing a report summarizing these findings next week, and please visit our website to find that. As part of that report, there are a few particular recommendations that we're making for short-term actions that states and others need to take to respond to this crisis. The first of those is the inclusion of women, girls, non-binary, trans, and gender non-conforming persons with disabilities in the planning, implementation, and monitoring of the COVID-19 response. Those voices, people who are living at that intersection, their voices are really essential to the design of these responses and to avoiding many of the factors that exist here. A second is that governments need to mandate healthcare protocols related to rationing of care that ensures that rationing does not take place in a discriminatory manner, including on prohibited grounds such as gender and disability, and that needs to also be monitored as it's implemented, because many doctors and others may be making those decisions on a case-by-case basis. And then finally, a third is that support services and gender-based violence services need to be declared as essential services, and processes for getting, for instance, movement permits need to be streamlined for those service providers so that they continue to support persons with disabilities and women and girls in particular during these times. We are at the moment concentrating on immediate response, but I just want to also echo what Catalina said about ensuring that we build back better. We're hoping in the coming months to draw some lessons from the survey and other consultations with women and girls with disabilities worldwide to create some lessons learned about this crisis and about how to ensure that human rights are fully respected, protected, and fulfilled the next time there is a crisis like this. So thank you very much.
Thank you very, very much. And where you have just ended with recommendations, really segues into an audience, a participant question that we have from John Zeto, who says it's becoming more evident that those particularly prone towards being infected are racial minorities, poor people, older people, and disabled people. And within a totally pro-profit system, he says, or with leaders like Trump in power in the US, what can we do to address these issues? Just inviting any of the panelists to come in on this. We have about 15 minutes for the discussion period, and we have a few questions. So I'd love to hear if any of you would come in on that question of really what can we do within this existing system? Or what do you propose as to how to change it?
If I may.
Please.
Of course, I mean, it's a very important question. And again, I think that is the opportunity that we're facing now, right? Whether we're gonna challenge the current system and how we're suffering not only from the current decisions of political leaders or the backlash that we're seeing in human rights recognition, but also because of the measures that we're taking in many cases, all the austerity measures that had impacted so much in this crisis because they had undermined the social security system, universal healthcare systems in many places of the world. And so the question is how, again, do we need to reflect as a community, as an international community, aiming to protect human rights and lives? How do we want to respond to this, right? I think that the pandemic is giving us a tremendous opportunity to get back to what are the foundations of a democratic society and how the recognitions of the determinants of health, the structural discrimination, poverty, and exclusion are causing are making this tragedy even worse. You know, we could have had better positions, but we have destroyed our social security networks, the social protection systems, through these austerity measures. And so this is really a question, I think, of a fundamental change in the system. And we are not going to be able, I believe, to just put patches to something that is proven to not work, right?
It would be great to hear from anyone on that question as this unfolds. I'll also invite more generally a look towards the future. Invite any of you to reflect on, you know, are there worse case scenarios down the pipeline? Are there other things you're worried about that we aren't even seeing yet, or that we should be thinking about and anticipating that are concerning you now? And on the other side, are there bright spots that you have seen, or kinds of learning that are occurring, or possibilities in this time as we look to the next step? So just to broaden the scope of that question as well, for anyone who would come in on that.
I'll answer in relation to the dark spots. I think would be if we had a second wave. So we had like a Spanish flu type situation where resources had been depleted, societal panic set in, and there was a real lack of law and order in relation to what was to occur, and there was a real...
Ben, your sound is coming in and out a little bit for me.
Okay, I'll just is that better, close to the microphone?
Better, yeah, thank you, that's
I
great.
think
The frame of what you're describing, is this something you're anticipating or concerned about? This is what you're...
I'm hopeful it doesn't occur. I'm not anticipating it. I think the whole reference to why what we've done in terms of flattening the curve is to prevent this taking place, and it's incredibly important. But in certain developing countries, we may have a situation where the pandemic does get out of control, and that would be very serious in terms of sort of law and order and how people with disabilities are treated within that setting, and that could be a very dark situation. I think the bright spot is that when we look at what is good policy and how we develop it, governments are starting to realise the importance of having people with disabilities involved in that policy making framework. They're starting to realise that policy that reflects the diversity of the human population in which they live is good policy, and that taking into account people's unique natures in healthcare systems is incredibly important, and it should go on for post the pandemic, because we don't know what will occur into the future. So we're going to plan to have a better, more robust healthcare system that takes into account more circumstances in a more compassionate way for longer, which I hope is really important.
Thank you for that, Ben. Anyone else? Amanda, I think I see you taking your off. Thanks.
Yeah, just adding to that, it's something that was identified in our survey and that we're hearing from partners on the ground on the dark side of things, is that the issues I identified about meeting basic needs, accessing food, sanitary items, hygiene-related issues are getting worse and not better as lockdowns, shelter-in-place orders, et cetera, and disruptions just to the community generally are increasing. So that is something I see as being on the dark side and potentially continuing for a long period and impacting the lives of persons with disabilities disproportionately. On the brighter side, I have seen an increase in the mobilization of the community, particularly of women with disabilities. There's an excellent organization operating out of India called Rising Flame that has organized just global community sit-ins and listening sessions and chats just amongst women with disabilities worldwide, so that they can be sharing their experiences, reaching out of isolation where they're in it, and touching base with other people whose experiences are like theirs. And it's encouraging to see that mobilization occur, and it feels like the first step towards towards something bigger. And so that's been a bright spot.
May I also react?
Please.
Yes. No, I do think, despite what I said at the beginning, that we were not ready, we didn't have a strong foundations on a human rights-based approach to disability. It is true that without the convention, we would have been in a worse position, right? So I think that actually we're better prepared than we would have been 12 years ago. And that what we're seeing is, and I don't think, I want to be actually optimistic. I don't think that as a humanity, we can't afford to lose this opportunity to learn and to do things better. One thing that we have learned is that unless we do this all together, this is not going to work. So if we are fighting a pandemic and we still have hotspots because people is not able to access services, or because of structural barriers, or because of lack of information communication, so we are not actually preventing the infection from spreading, right? And that could work in any other field. So I do think that I want to be optimistic. I'm seeing, for instance, the responses of the UN system. I'm an independent expert. I'm not formally part of the UN system, but although some of the responses have been late, and we have to acknowledge that, now we have clear responses and solid responses coming from WHO, from the Secretary General, from different agencies. I want to see more engagement of the donor community that also over the last 10 years have shifted his approach in development cooperation to support inclusion of persons with disabilities in a better way. We have the SDGs, which are also a good framework for inclusion of persons with disabilities and the notion of leaving no one behind. So we have frameworks that are already more inclusive than they were 10 years ago. But we now have to use the opportunity and not miss this opportunity to learn from those very sad lessons that we have, and continue to push for the transformations. And I agree with Amanda, there are encouraging examples of practices around the world that are showing us that that change can happen and that we're ready to engage. And I think, Elizabeth, as you said at the beginning, innovation will be key to this, right? It's going to take everybody in the room to decide how do we move forward to make this work. And this is the great challenge, right? But we cannot do it, and this is, I think, my premise. We will not be able to succeed as humanity unless we do it with everyone, including persons with disabilities, women, indigenous, everybody. Thank you.
Well, thank you very much. I'm going to bring in just a couple of questions together and then invite final remarks, and particularly the time goes so fast in these things, particularly Mohamed, if you want to come in on this. But just to note, we've had some questions and comments. One comment, Diana Samarison, I completely agree with Catalina that we need a fundamental change in the system. I'd ask you to use this time to also push philanthropy to make big changes to include persons with disabilities in decision-making about where money goes. Also, just to raise the issue, Amalia Gamio asked the question whether anyone has information if forced medication is increasing in institutions during the pandemic. And I'll add there that, you know, one of the things that's been very troubling, many things that have been so troubling during this time has been to see how long it's seemed to take for anyone to produce, or at least widely circulated, a document addressing the particular needs of people with psychiatric disabilities during this time. There seemed to be a long lag where there were other kinds of information available of different sorts, particularly a lot of public media coverage of what people who don't have any kind of psychosocial disability should do to deal with their stress. And at the same time, really something missing, that is, what if you're someone who, you know, we've been talking about people already in institutions who are in great peril, but also someone who goes in and out of institutions, you know, as part of your treatment over time in a chronic condition. You know, what's your plan B? You know, how do you make sure you get your meds? Do you try to avoid an institution at all costs? You know, what are the steps? But anyway, it seemed as though there was just a big lag in having information of that sort out there. And I don't know if we're just seeing another instance where those with psychosocial disabilities are being left behind, or if there's something more we can learn here. As a opening to the final moments, in case anyone wants to reflect on it, I also just wanted to ask if any of you have any, anything that's getting you by in this time, any words, any resources, as we're all looking for wisdom, but just to invite you to offer what you'd like to say in conclusion. Mohamed, do you want to begin?
Thank you, thank you, Elizabeth. I want to thank again all organizers for this meeting. People with disability, just we can be the same to the like other people when we are included for every aspect of life. So even the government and states must be include people with disability and their organizations, the method of prevention of COVID-19, because they have to be a part of the table when the decision is taken by when the decision is making. So what I'm saying, and I wanted to conclude my remark is nothing us, nothing without us. So that's what I am saying and what I am concluding for this for this meeting in my side. Thank you.
Thank you so much. Ben, would you like to say anything in conclusion?
Certainly. In terms of what gets me by, I think you get by appreciating the simple things in life, friends, family, the very basics of human interaction are what gets you by. Where I have concerns for people with disabilities is in relation to people who have complex support needs, psychosocial disabilities, have intersectionality considerations, are not able to advocate for themselves very easily in society, and not able to join DPOs or civil society when we have pandemics or natural disasters such as bushfires in Australia. These people get left behind, and we have to plan in advance to ensure that people who are challenged in those circumstances are looked after. And that's why education, awareness raising and data collection is so important. We need to educate all our doctors, teachers, politicians, media about the importance of ensuring that when we look at disability, we look across all people with disability to ensure they're included. We need to then collect data on what occurs. We need to learn from it repeatedly and really emphasise what is good practice and call out bad practice. But there are some very real concerns relating to ensuring that things like forced medical treatment are not occurring. But I'm hopeful that over time, we realise with the CRPD that that's going to become less, and that the only way to get there is through awareness raising, education and data collection.
Thank you so much. Amanda?
Sure, just very briefly, one thing that's getting me by during this time is I'm lucky to be stuck at home with my family, which includes an infant and a 3-year-old who it's been wonderful to see grow and develop over the past couple of months in a way that an opportunity I wouldn't have had otherwise. It's got its challenges, certainly, but a lot of pleasure coming from being able to be with them all day, every day, and be an even bigger part of their lives. But just to say, in terms of moving forward and some including remarks related to women and girls with disabilities, I really hope that the work that we're doing, the work that Catalina is doing and others around the world are going to be bringing more attention to these issues, and in particular, these issues as being just an exacerbation of what has existed previously. And that I'm hoping as a global community, we will be able to organize to lift ourselves up, to combined with other movements across the world to ensure that the world treats us all better, whether we are women, whether we're persons with disabilities, racial ethnic minorities, living in poverty, etc. That we all are people who have lives of value, and that human dignity is really the core intersecting message between us all. And so I'm hopeful that as a result of this crisis, we will see that core message of humanity emerge and lead to positive change.
Thank you very much. Catalina, will you close us off?
Yes, thank you again. I believe, I would like to just touch briefly on the question on persons with psychosocial disabilities, because I think that's quite an important subject that we sometimes overlooked. And specifically, as you said, because of this is still very medical model approach of discussing mental health and thinking that by discussing mental health, we are covering all the spectrum, and by just providing public health or services for the mainstream community, we are not thinking of the specific challenges and rights violations that persons with psychosocial disabilities face. The whole disruption of the support services for persons with intellectual disabilities have for instance, resulted in lack of services in the community. And that results also in an increase in the number of people that is hospitalized because they don't have the resources or the services in their community. The measures that they're taking in hospitals, for instance, to the security measures to control the pandemic means that some of the rooms have become isolation rooms for people that is the meaning of an isolation room has a completely different meaning. The services sometimes are provided online with many challenges because they have no experience on how to provide these services online, breaches on confidentiality, privacy, many concerns about how they can continue to get the support with the trust and the safety nets that they need, as well as, of course, what I mentioned at the beginning, the use of measures that are not proportional and that are justifying coercive practices that should never be allowed. So we really need to think of this as an issue that deserves particular attention, and it's one of the communities that is most marginalized. And in general, to end, I wouldn't agree more to say that, of course, we need to have participatory approaches for anything. It's time to bring persons with disabilities to the front line in the design of the responses. We need to be there. We need to contribute to the responses. But also, I think a call to the human rights community in general. One of the lessons learned that I have as being the first mandate holder on the rights of persons with disabilities is that we're still struggling internationally to get the disability rights perspective to be considered as a full human rights issue. And we need to work in collaboration and an alliance with all the justice sector, with all the human rights sector, to understand that our situation and the violations that we face are not issues that are solved in policy development or only through social protection or to charities. We really need to understand that this is our complex human rights situation, complex human rights violations, grave human rights violations, and that we need to work together on this to combat them and to work in an atmosphere of solidarity and learning. And as we also in the sector of the rights of persons with disabilities need to learn more from the other groups and include their perspective a little bit better in the work that we are doing. And I'm glad, for instance, the work of UN Women Enabled is doing is fantastic and working on those intersections. We need to see more of that and this cross-fertilization that I think is the only way that is going to make us move forward. And I thank you very much again for the opportunity.
Thank you. Thank you, each of you, for being here for this discussion and for the vital work that each of you is doing. And thank you to all of the participants, too, for being here. As this is one of many conversations that needs to happen and part of so much work that needs to be done as we move forward. Thank you all.
You're welcome.